eu me chamo Ana Júlia.
Eu me chamo Kamylle.
Eu me chamo Bianca.
E nós somos alunas do segundo período de radiologia e vamos falar sobre acidente vascular cerebral, mais conhecido como AVC.
This is the first part talking about stroke. And in this video, we will talk about Introduction to Stroke, differences between stroke and TIA, statistics and pathophysiology of stroke. Cerebrovascular accident stroke occurs when blood vessels supplying blood to the brain become blocked or rupture, leading to paralysis in the affected area of the brain that lacks blood circulation. The brain receives blood through large arteries that deliver oxygen and nutrients. These main arteries include carotid arteries and vertebral arteries. These arteries are interconnected in a system called the circle of Willis, a kind of safety net that can redirect blood if one artery becomes blocked. Ischemic stroke. This type occurs when an artery is obstructed, preventing oxygen from reaching brain cells, which eventually die. This obstruction can be due to a thrombus thrombosis or an embolus embolism. Ischemic stroke is the most common type, accounting for 85% of all cases. Hemorrhagic stroke. This occurs when a blood vessel in the brain ruptures, causing bleeding. The hemorrhage can happen within brain tissue or on the surface, between the brain and the meninges. It accounts for 15% of all stroke cases, but is more likely to result in death than ischemic stroke. Ischemic stroke. When an artery becomes blocked, for example, by a clot or fatty plaques, blood fails to reach a part of the brain. This lack of oxygen causes cell death in the affected region. The larger the blocked vessel, the greater the area of damage. Hemorrhagic stroke. In this case, the rupture of an artery causes blood to leak inside or around the brain. This not only prevents blood from reaching brain cells, but also increases pressure inside the skull, which can worsen the damage. The main difference between a transient ischemic attack TIA and a stroke is the duration of symptoms. Stroke, a significant cause of death and disability. In the Brazilian adult population, TIA, a temporary interruption of blood flow to the brain that resolves spontaneously within 24 hours. The symptoms of a stroke and TIA are similar and include changes in alertness, sensory alterations, mental changes, muscle problems, dizziness or loss of balance, and nerve issues. A TIA should be evaluated by a doctor, as it may progress to a stroke despite not causing permanent damage. Identifying and treating the cause of TIA is crucial before it leads to a stroke. Hypertension is the primary risk factor for stroke, followed by smoking, diabetes, and physical inactivity. Managing these factors can significantly reduce stroke risk, highlighting the importance of healthy habits and medical follow-up. Mechanisms of ischemic stroke. Thrombosis. A thrombus forms in the artery involved in the stroke. Embolism. The thrombus originates from another region and travels through circulation to impact a cerebral artery. Narrowing of blood vessels. Uncontrolled high blood pressure or atherosclerosis can change the shape of blood vessels, making them thinner and less elastic. Decreased systemic perfusion. Low blood pressure, hypovolemia, or heart failure can reduce systemic perfusion. Mechanisms of hemorrhagic stroke. Rupture of an aneurysm or cerebral artery. Uncontrolled high blood pressure, hemophilia or other blood coagulation disorders. Head or neck injuries, radiation treatment for brain or neck cancer. Cardiac arrhythmias, heart valve diseases, congenital heart defects, vasculitis, heart failure. Thank you very much for watching the first part until the end. Don't forget to check out the second part.